it is my true pleasure to introduce Candace Silverstein.
Thanks to everybody for being here tonight. It's great to see everybody out. I'm going to talk about the pregnancy and heart disease program here at Sinai. And I have to start with why, which is why am I talking about pregnancy? We're supposed to be talking about cardiac issues. Well, the issue is that pregnancy puts a stress on the heart. And so if you're young and you have a heart condition, that can lead to complications. But even if you're healthy and well, sometimes that stress can cause a healthy person to develop a cardiac condition. So for instance, about 10% of women that are pregnant develop high blood pressure during pregnancy. And a fraction of those, 3% of all the women that are pregnant, develop something called preeclampsia, which is a very malignant form of high blood pressure. So sometimes you can develop these new cardiac conditions even if you're healthy. So even though we think pregnancy is all about delivering a baby, it's actually a very important cardiovascular stress. And the issue is, why then did Sinai get interested? Well, it started with this man, along with a cardiologist named Jack Coleman, and they were curious as to how women with heart conditions would do throughout pregnancy. And so back in the day, say 30 or 40 years ago when they were just starting, there was this surge of young women with heart disease that were coming over to Sinai and to the Toronto area to deliver babies. So there was this influx of these young women with heart disease that were now thinking about getting pregnant. And that was because in the past, young women who were born with heart conditions, there wasn't surgeries to fix the heart, and so they never made it to childbearing age. And then in the 70s, the 80s, the 90s, these new surgeries were developed. These women started living. They hit childbearing age and they asked, well, can I have a pregnancy? I know it puts stress on the heart, but nobody really knew if they could or couldn't have a pregnancy. And so in fact, the default answer was no, you can't. It's going to be too stressful for the heart. In fact, if you go and look at many young women and ask them, did anybody ever tell you you can't have a pregnancy? Many, many have been told that because that was the common belief. So the issue, though, is nobody really knew. People just believed that you shouldn't have a pregnancy. And the team at Sinai, Matt Surmer, who I showed you earlier, and Jack Coleman, decided that wasn't just good enough to have a default and tell all young women with heart conditions they couldn't have a pregnancy. So they developed a formal collaborative to try and not only care for these patients, but also to try and start understand, is pregnancy really as risky as everybody thinks? And so for a few decades, they saw patients, they looked after patients, but they also tracked everybody they saw. And in the early 2000s, a groundbreaking study was published by the Mount Sinai team and that described the risk of pregnancy and heart disease. This is the only data from studies I'm going to show you, but what they found is if you took, say, for instance, 10 women, 2 of those women would develop heart complications during pregnancy. So kind of giving some numbers to that thought that maybe pregnancy could be dangerous to that population. But more importantly, they showed that actually most of those troubles that occurred could be fixed with medicine. So it wasn't as bad as originally thought. These women weren't dying. You could get them through pregnancy. Furthermore, you could use these risk tools, because we develop risk scores, to predict who would be in trouble, then provide extra surveillance, catch things early, nip it in the bud, and get them through pregnancy, doing a little better. And so that whole philosophy of routinely telling women they couldn't have a pregnancy if they had a heart condition completely changed. And that was really thanks to the team at Sinai. So this is an example. This was a study of, a story that was run on Global News. And this is Jennifer. She was born with a congenital heart disease, and it was repaired when she was a kid. If she had been born about 20, 30 years earlier, she would not be here to tell this story because those surgeries were not developed yet to keep her alive. But she happened to be born at the right time, had her surgery. However, like I mentioned, she was told when she was 18 she wasn't going to have a pregnancy. It was too hard on her heart. Luckily, she, at that point, was referred over to the Sinai Heart program that me and my team are involved with. And at that point, we started to have some familiarity with her condition. But nonetheless, you can see her quote, the second bullet here. She said she was terrified because a lot of people with her condition or similar conditions had been told they couldn't have a pregnancy, or told if they did have a pregnancy, they'd have to terminate it because their life would be in jeopardy. But luckily, she got into the Sinai program's hands. She learned a little bit about the risks, what the risks would be, but none of them were really potentially fatal. And so using that information, she made an informed decision and decided to proceed on with the pregnancy. And it wasn't easy. She had 5 miscarriages. She, in fact, was giving up, was thinking she'd just adopt. And then, as luck would have it, she became pregnant. She was followed at Sinai throughout the pregnancy, and she delivered this lovely little girl. And so what happened with the program at Sinai? Well, it continued to flourish. And over the next 25 years, research continued. We saw more and more patients, and it really became a center of excellence around the world for this field of cardiology. That population of young women kept growing and growing, and we kept seeing more and more. We got a beautiful space at Sinai to run the clinic, and we ran a joint clinic with obstetrics. So cardiology and obstetrics, women would come in. They would see both teams at the same time. It was one-stop shopping. We were catering to patients, and we were really developing a program that we were proud of that was tailored to the patients. And our team also grew. So what started out as a cardiologist and an obstetrician grew to many cardiologists and many high-risk obstetricians. And that program that started out with just cardiologists grew to include neonatologists, geneticists, obstetric medicine physicians, and many other team members. The American Heart Association a few years ago ran a story about what to do about these high-risk pregnancies, and they quoted a study from Sinai here showing that we were able to, with this coordinated care, drop the rates of heart failure in the pregnant population by half. And then our team has also gone out in the world and tried to teach the rest of the world about what we're doing here that seems to be working. We've had invited lectures at many countries around the world. These are some flags of where we've given talks. We've developed national and international guidelines. This is not myself, but my whole team. And then we've been extremely fortunate to have support from philanthropy, and we've had Miles Nadal support both the education and the research in our program. Now, we've been training people for many years, similar to what Susanna said, but we've trained more than 90 cardiologists who have learned about pregnancy and heart disease and then scattered around the world to start similar clinics in their own and take care of this high-risk population. And then kind of one of my final slides just about the program is that for many decades now, we've not only been caring for patients, but we've really been doing research, trying to advance the field. And not only did we figure out what the risks of pregnancy are, but we've looked at how to deliver better care. And now we're starting to look at whether or not we can use some new AI tools and apps and smartwatches to detect complications early and treat women better. So I'm going to end with a couple last slides just about another patient that we saw in our clinic. This was Sadie Stout. She was 21 years old from Thunder Bay, and she was 7 months pregnant. There were some days, this the paper said, the Toronto Star, when Sadie Stout was tired and had trouble catching her breath. Back to shortness of breath. It's a common theme. But she and her mother, Louise Chambers, attributed her symptoms to asthma and the normal fatigue that comes with pregnancy. It was only when Stout had heart palpitations when relaxing on the couch that her mom became worried. So this is an echocardiogram. When we're worried about the heart, we do echocardiograms. You're going to perhaps go to the echo lab today and hear a bit more about it. But on the left-hand side of your screen is a normal heart. It has 4 chambers. They're black inside because they're filled with blood. There's 2 pumping chambers, the right and the left ventricle, and 2 filling chambers, the right and the left atrium. And that's a normal heart on the left-hand side of your screen. On the right-hand side of the screen is what the patient has. See that big blob of gray in the middle of the heart? That's a tumor. And so this patient, Sadie, had this rare tumor growing inside her heart, and she was pregnant. Within days after her diagnosis, she was flown to Toronto because this is a center that deals with really complex problems in pregnant patients. There was a lot of talk about what to do to deliver the baby, to fix the mom's heart, to leave things alone because everything was so risky. But ultimately, the decision was to deliver the baby here at Sinai. So despite it being a very high-risk delivery, Kelly Murphy, who's one of the high-risk obstetricians in her team, delivered her son, Bentley. You can see he was tiny, very premature, only 3 pounds. And then Sadie went on to have her surgery soon after her delivery. Lucky also she was down at Sinai because that little premature infant had the benefit of being in really one of the leading North American centers for neonatology. And so I want to just end with that case showing that that's why we do things here. That's why we've developed this program, and I'm so proud to be part of it. And I just wanted to thank everybody who's been so kind and generous to help develop the cardiac program here at Sinai. Certainly all the patients we see benefit from your generosity. Thank you.